Mr. Speaker, I rise to contribute to the motion for debate this afternoon, and that is on the review of the Auditor-General's report on compliance audits relating to COVID-19 response. Before that, I would just like to thank the previous PAC committee for scrutinizing the report, deliberating on the report, and tabling back to Parliament. And I also thank to the new committee as well for tabling. Mr. Speaker, so I'd like to be brief and keep my comments on the three programs that came under review this year on the Auditor-General's report. And that is, one is that the implementation of COVID-19 preparedness and response plan, procurement of biomedical equipment and quarantine accommodation, and stock management for COVID-19, and management of COVID-19 aid. Honourable Speaker, sir, the COVID-19 outbreak was an unprecedented event that did test all our existing processes. We note the oversight of the Auditor-General's recommendations, and the following is an update on our response to date. One, there has been ongoing discussions with NDMO on facilitating a collaborative framework through the National Emergency Response Team mechanism to ensure there is interoperability between agencies to enhance disaster response. Secondly, the facilitation of simulation exercises and the facilitating better communication and advocacy capability is an ongoing exercise with development partners and is a key part of level 2 of the preparedness and action plan. The key focus is on maintaining high levels of readiness within the ministry and nationally. And as alluded to by the Honourable Leader of the Opposition earlier on, in terms of our preparedness, as I mentioned, started with a program that the previous government had initiated, and the term of preparedness in terms of what the Ministry of Health is doing, in terms of our preparedness for any overseeing any pandemic in the future or any national disaster, that is continuous, and we are trying to strengthen it as well, Mr. Speaker. Mr. Speaker, as mentioned in the report, the Ministry of Health and Medical Services, IMT, has developed an expenditure matrix with 10 key objectives, and this is being used to manage current COVID-19 funds. We will maintain and refine this framework with NDMO through NERT to ensure better resilience. And we note in the report that there was no cabinet endorsement, but as mentioned by the Honourable former PAC chairman, that at the time there was the need was for work done first and endorsement maybe to come in later. But we try to say that the cabinet paper is being prepared to endorse our Border Health Protection Unit so as to better coordinate quarantine processes, including its financial management. Speaker, so all equipments projected for the COVID-19 response were received and payments remitted to the awarded vendors. There are equipment such as ventilators, bedside monitoring equipment, airways, hospital beds, thermal scanners, biosafety cabinets, etc. So, Speaker, sir, the management of the pharmaceutical stocks is currently being strengthened. The implementation of the M supply system that was installed in the first quarter, financial year of 2021-2022. All donations received and dispatched are managed through the standard operating procedure, driven through this new warehouse information management system. So, M supply is a warehouse information and management system that covers end-to-end processes from procurement right down to distribution. Those few words, Mr. Speaker, sir, I commend the motion before the House.